Weak hip flexors, causes and symptoms. Weak hip flexors can cause the surrounding muscles to overcompensate, which can cause pain and difficulty walking. Treatment for weak hip flexors includes physical therapy and exercises. The hip flexors are muscles that connect the lower back to the hips, groin, and thigh bone. This muscle group includes the psoas muscle, which helps push the top of the leg upward. The hip flexors stabilize the lower spine. They play a major role in walking, postural alignment, joint mobility, flexibility, and balance. This video explains what symptoms and risks can come with weak hip flexors and how a person can strengthen them. Symptoms. The symptoms of weak hip flexors can affect a range of different areas in the body. General symptoms may include changes in gait and posture, knee pain, hip pain, back pain. These symptoms occur because the joints try to compensate for weak hip flexors, which leads to them overworking. Pain in the hip flexor area may be the result of a hip flexor strain. This is different from weak hip flexor muscles, although weakness can cause a strain to occur. Difficulty when walking. The psoas muscle is responsible for swinging the leg forward while walking. If this muscle is weak, a person may have to exert more energy and rely on other muscles. The rectus femoris muscle in the thigh and the hamstrings. These muscles may overcompensate during walking, which might put excess strain on them and cause discomfort. A person may also find climbing stairs difficult, as it may be hard to lift the leg. Gait. Stiff knee gait is when a person walks with limited knee flexion or bend in the knee. Weakness in the hip flexors can lead to a stiff knee gait. A 2016 study involving 47 people with severe hip arthritis revealed a correlation between hip flexor strength and gait. Participants in the study with the strongest hip abductors and hip flexors had a better gait than those with weaker muscles in that area. However, other factors in the study that led to better gait or lower pain levels and better quality of life. Scientists concluded that muscle strength does play a moderate role in improving gait. Posture. A person may experience lower back pain if they have a weak hip flexor, as the hip flexor is an important spinal stabilizer. According to a recent article, weakness in the hip flexors can make it difficult for a person to maintain a straight posture. Weak hip flexors can also cause the pelvis to tilt, which can affect posture and cause lower back pain. Risk. Weakness in the hip flexors could result in injury, as well as the symptoms which mentioned earlier. An injury could occur to the spine, legs and knees if they have to overcompensate for weakness in the hip flexor muscles. What causes weak hip flexors? There are many different possible causes of weak hip flexors. This include lack of exercise. Not partaking in regular physical activity can lead to weak hip flexors. Underuse of the hip muscles can cause the muscle to degenerate and become weak, which is known as muscle atrophy. Sitting for long periods. Staying seated for extended periods can cause weakness in the psoas muscle. This is because the muscle does not work as hard as if the person were standing. Osteoarthritis. Osteoarthritis in the hip can also cause weak hip flexors. It can also cause weakness in the knees, hamstrings, and buttock muscles. Lateral transverse surgery. Lateral transverse surgery, a type of operation on the spine, can often leave a weakness in some hip flexor muscles. Cerebral palsy. According to an article in the Journal of Ultrasound Medicine, people with cerebral palsy may experience weakness in the hip muscles. Cerebral palsy can also increase the risk of hips coming out of joint during childhood. Tight or weak hip flexors. Weak hip flexors are not the same as tight hip flexors. Sitting for prolonged periods could cause the hip flexors to become tight as well as weak. Symptoms that come with tight hip flexors include lower back pain and hip pain. Underuse of the muscles or sitting down for extended periods can cause weak hip flexors. Conditions such as osteoarthritis can also cause weakness in this muscle group. A person with weak hip flexors may experience lower back or hip pain and may have difficulty doing certain activities such as walking or climbing stairs. Weak hip flexors can affect a person's posture and the way they walk. To remedy weak hip flexors, a person can try a range of strengthening exercises that target the hip flexors.